Good afternoon. I'm nurse at St. Francis Hospital. How can I help you?
Hi, I'm calling about my 18-month-old son. He's been experiencing some frequent diarrhea, vomiting. He has a low-grade fever, and he's also had some bloating.
Okay. It sounds like your son's experiencing what we call gastroenteritis. Your son's actually, did you say 18 months?
Yes.
Okay. That's like around the age group. Usually we see it most commonly in 6 months to 2 years in our pediatric patients. Gastroenteritis is a condition causing irritation and inflammation of the stomach and intestines. It can be viral or bacterial. Viral is what we see most commonly, but bacterial can be caused by foodborne illness or parasites. Also, some people refer to it as the stomach flu. However, influenza has nothing to do with gastroenteritis. And severity usually depends on the immune system's ability to fight off the infection. And I noticed, I heard you saying he has vomiting and diarrhea, and you said a low-grade fever?
Yes.
What was his fever?
It was like just 100.
Okay. If he has any blood in his vomit or stool, if you notice that he's becoming increasingly dehydrated, if he's weak, has lightheadedness, decreased urination, you want to make sure to bring him into the office.
What can I do at home for him? Is there any medication I can give him?
Well, you'll definitely want to make sure that he stays hydrated. We prescribe antibiotics for bacterial gastroenteritis, but we'll need to see him to actually rule that out. We prescribe antiemetics, which those are to help his nausea and vomiting. We'll prescribe Phenergan, Energan, Compazine, or Zofran. Sometimes the doctor wants to prescribe those in a suppository form because the child can't keep the pill down, so we'll probably just prescribe it as suppository. And some doctors also recommend over-the-counter anti-diarrheal agents for patients over 3 years. So he may or may not prescribe that for your little youngin'. But either way, if he does prescribe it, it'll be Lamotil, Lennox, or Imodium.
Well, I didn't really know what to do, but I have been trying to keep him hydrated and rested, and I've also been watching his fever. Is there anything else I should be doing?
Well, you're doing the exact thing that we like to see parents doing, but you'll want to continue to monitor his dehydration. He'll want to stay on clear liquids for 24 hours. After each loose stool, you'll want to make sure to rehydrate him with 1 to 3 ounces of fluid, and that's for any child under the age of 2. And for children older than 2, you'll want to make sure after each loose stool that you rehydrate them with 3 to 8 ounces of fluid. Also, you want to make sure you're practicing good hand hygiene. You want to make sure you're eating and storing your food properly. And just like I said, keep them hydrated and comfortable. Did you have any other questions?
No, thanks for your help.
Okay, and if there's any further problems, go ahead and bring them into the office.
Okay, thank you.
Bye-bye.